Hello, my name is Chris Lane, and I am the HIV Program Supervisor at the Frederick County Health Department. I would like to speak with you about the progress being made to end the HIV epidemic and some of the challenges that remain to be solved. The good news is that the number of new HIV diagnoses nationwide has dropped from about 50,000 per year down to 40,000. Despite this recent progress, African Americans, more than any other racial or ethnic population, continue to be disproportionately affected by HIV in the United States. While African Americans represent approximately 12% of the total U.S. population, they accounted for almost half of all new HIV diagnoses each year. Southern states also account for the highest proportion of new HIV diagnosis, illness, and death across the nation. Southern states account for an estimated 44% of all people living with HIV, although they make up just over 1/3 of the national population, 37%. What we are currently seeing is that HIV test rates are continuing to increase, and that more than half of Americans have yet to be tested for HIV. The CDC in 2006 and the Preventive Services Task Force in 2013 made HIV testing a Grade A recommendation that should be offered as a standard of care by all primary care providers, meaning testing their patients as part of the routine yearly checkup. Key barriers to HIV testing include HIV stigma, lack of access to health care, fear and misperceptions about HIV risks, the testing process itself, and in addition, some healthcare settings have yet made HIV testing a standard of care, meaning a routine part of medical care. HIV stigma often reinforces existing social inequalities based on gender, race, ethnicity, class, sexuality, and culture. Stigma against many vulnerable populations who are disproportionately affected by HIV, such as the stigma of homosexuality, drug use, poverty, migration, gender status, mental illness, sex work, and racial, ethnic, and tribal minority status, predates the epidemic and overlaps with HIV stigma, which hinders efforts to provide HIV testing within these communities. Stigma and discrimination add barriers which weaken the ability of people and communities to protect themselves from HIV and to stay healthy if they are living with HIV. Stigma about HIV discourages many people from seeking information and programs for fear it will make others think they have HIV, are promiscuous, or unfaithful, or are members of populations associated with HIV, like people who inject drugs, sex workers, and gay men. It can make people less likely to get tested for HIV, use condoms, ask their partners about their HIV status, use clean needles and injection equipment, or access pre-exposure prophylaxis, PrEP. HIV testing is critical in helping to prevent new infections. CDC estimates that 15% of people infected with HIV in the United States are unaware of their status. That's more than 161,200 people nationwide. The estimate for Maryland is slightly higher than 15.3%, and new HIV testing outreach programs are aiming to reduce this figure. CDC recommends that all adolescents and adults aged 13 to 64 years old get tested at least once for HIV as a routine part of medical care, and that people of higher risk get tested at least once a year. So if you are a man who has sex with men, had sex with someone who has HIV, had more than one sex partner since your last HIV test, or used intravenous drugs and shared needles with someone else, then you should be tested more often. At Frederick County Health Department, our outreach program is working to increase testing in a wide range of settings, including locations outside of the medical system, locations frequented by people at higher risk for HIV infection, locations like health fairs, colleges, stores, churches, and pharmacies, as well as at the Frederick County Health Department. HIV testing has never been quicker or easier than it is today, and it has significant benefits for individuals who are infected with HIV and those who are not. For those who have HIV, testing is the gateway to treatment and care. Highly effective treatments make it possible to live a long, healthy life with HIV. For those who test negative, they can gain information on how to prevent HIV and protect themselves going forward. It is important to know that 1/3 of people are being diagnosed late. This means that they have already been infected for many years. For those diagnosed late, their immune system is already weakened and showing signs of AIDS-related opportunistic infection that can cause serious illness or death. It is important for everyone to get tested. Testing helps reduce the transmission of HIV. Early diagnosis allows those infected to take steps to protect their partners from infection. Early treatment can lower viral load and reduce the risk of transmitting HIV to others by 96%. Whether you get tested at Frederick County Health Department, one of our outreach events, or your healthcare provider's office, the important thing is to get tested and take care of your health. Frederick County Health Department testing hours are Tuesday and Friday, 9 to 10:30 and 2 to 3:30. Check our website for outreach times and locations, or give us a call for further information or to schedule a test.